Myxomatosis in rabbits is a disease that strikes fear into the hearts of rabbit owners and breeders worldwide. Often devastating, this viral infection has the power to decimate entire populations of rabbits if not carefully managed. Whether you keep rabbits as pets, raise them for breeding, or manage them on a farm, understanding myxomatosis is crucial for their health and welfare. First, let's delve into the basics. What exactly is myxomatosis? Myxomatosis is caused by the Myxoma virus, a member of the poxvirus family. Originally found in wild rabbits in South America, the disease was deliberately introduced in various countries, including Australia and parts of Europe, to control wild rabbit populations that were considered pests. However, the consequences have been severe, with domestic rabbits also falling victim to this highly contagious disease. The Myxoma virus spreads primarily through biting insects, especially fleas and mosquitoes. These vectors pick up the virus from infected rabbits and transfer it to healthy ones as they feed. Direct contact with infected animals or contaminated objects can also contribute to transmission, although this is less common. The virus is remarkably resilient, capable of surviving for extended periods in the environment, which makes controlling its spread a significant challenge. Now, let's talk about the signs and symptoms of myxomatosis in rabbits. One of the most heartbreaking aspects of this disease is how rapidly it can progress. The earliest signs are often subtle, slight swelling around the eyes, nose, and genitals. As the virus takes hold, these swellings become more pronounced, quickly developing into gelatinous lumps known as myxomas. The rabbit's eyes may appear swollen and partly closed, often accompanied by a thick, milky discharge. Their ears, lips, and nose might also become puffy and inflamed. As the disease advances, affected rabbits may experience difficulty breathing due to swelling around the nose and mouth. Eating and drinking can become challenging, leading to dehydration and weakness. Skin lesions, ulcers, and secondary bacterial infections are common, further compromising the rabbit's health. Lethargy, fever, and a general decline in condition are typical as the disease progresses. In most cases, myxomatosis is fatal, with death occurring within 1 to 2 weeks of infection. Rarely, some rabbits survive, but they often endure weeks of suffering and may be left with lasting health issues. Prevention, therefore, is the key to protecting your rabbits from myxomatosis. One of the most effective preventive measures is vaccination. Several vaccines are available that provide a level of protection against the Myxoma virus. These vaccines are typically administered once or twice a year, depending on the manufacturer's recommendations and the risk level in your area. While vaccination does not always prevent infection entirely, it significantly reduces the severity of symptoms and improves survival rates. In addition to vaccination, environmental control plays a vital role. Reducing exposure to insect vectors is essential. Use mosquito netting around hutches and living areas, especially during warmer months when mosquitoes are most active. Keep your rabbit's environment clean and free from standing water, which can attract mosquitoes. Regularly check your rabbits for fleas and use veterinarian-approved flea treatments as necessary. Quarantine any new rabbits before introducing them to your existing herd to prevent the unintentional spread of disease. Maintaining good hygiene is equally important. Clean hutches, bedding, and feeding equipment regularly using disinfectants that are safe for animals. Limit contact between your rabbits and wild rabbits, which are often carriers of the Myxoma virus. If you live in an area where myxomatosis is prevalent, consider keeping your rabbits indoors or in fully enclosed outdoor spaces to minimize risk. Now, let's explore the cause of myxomatosis in greater detail. As mentioned earlier, the disease is caused by the Myxoma virus. This virus is highly specific to rabbits, meaning other animals and humans are not at risk. The virus targets cells in the skin and mucous membranes, quickly multiplying and causing the characteristic swellings and lesions. The immune response in rabbits is often overwhelmed, allowing the virus to spread rapidly throughout the body. Understanding the life cycle of the virus and its transmission routes is essential for effective control. In areas with high mosquito or flea populations, outbreaks of myxomatosis are more frequent and severe. The virus can also be spread by direct contact with secretions from infected rabbits, though this is less common. Once introduced into a population, the virus can persist for months, making eradication difficult. Treatment options for myxomatosis are limited. Because the disease is caused by a virus, there is no specific antiviral medication available. Supportive care is the primary approach to treatment. This includes providing fluids, nutritional support, and keeping the rabbit comfortable and warm. Pain relief and antibiotics may be given to manage secondary bacterial infections and ease suffering. In mild cases or vaccinated rabbits, recovery is possible, but the majority of unvaccinated rabbits succumb to the disease. If you suspect your rabbit has myxomatosis, immediate veterinary attention is crucial. Early intervention can sometimes improve outcomes, especially in vaccinated rabbits. Your veterinarian will assess the severity of the disease and recommend appropriate supportive care. In severe cases, humane euthanasia may be advised to prevent unnecessary suffering. While myxomatosis is a devastating disease, advances in prevention and management are helping rabbit owners protect their animals. Vaccination has become standard practice in many regions, dramatically reducing the impact of outbreaks. Public awareness and education about the disease have also improved, empowering rabbit owners to take proactive steps to safeguard their pets. Let's recap the most important points. Myxomatosis is a viral disease spread mainly by fleas and mosquitoes. It causes severe swelling, lethargy, and often leads to death in rabbits. Prevention is key. Vaccinate your rabbits, control insect vectors, maintain good hygiene, and avoid contact with wild rabbits. If your rabbit shows signs of myxomatosis, seek veterinary help immediately. Supportive care is the main treatment, but vaccination and environmental management are your best tools for keeping your rabbits safe. Staying informed about myxomatosis is essential for anyone who keeps or cares for rabbits. By understanding how the disease spreads, recognizing its symptoms, and taking steps to prevent infection, you can protect your rabbits and contribute to the overall health of rabbit populations. Remember, proactive care and vigilance are your best defenses against this deadly disease. If you're a rabbit owner, breeder, or enthusiast, take action today. Consult your veterinarian about vaccination options, review your rabbit's living environment, and educate yourself about the risks in your area. By working together, we can reduce the impact of myxomatosis and ensure a healthier future for rabbits everywhere.